Today we'll be discussing the sixth phase given by Dr. Voll. When any disease growing in the human body, it's passing from the two stages. Any disease passing from the two stages. One is when the disease is growing inside, but we cannot see any changes in the chemical report, in the lab report. And second phase, when we can see the chemical changes in the lab reports. So let's see. So I would like to do the comparison with the Ayurveda because the same thing has been given in the Ayurveda. As per the concept of Ayurveda, there are 6 stages of any disease development. 1, 2, 3, 4, 5, and 6. So the first stage is called the stage of accumulation. Accumulation means very little bit increase of dosha. We cannot see in the lab report. The second stage is called aggravation, means the toxin become too much. Still we can't see in the report. The third stage, now the toxin become too much, they are spreading here and there. Still we can't see in the report. In the first 3 stages, we cannot see in the reports. But the disease is growing. Toxins are increasing in the human body. You are going to the doctor. Doctors are declaring that you don't have any problem. Doctor might declare that you are just having psychological problem. In the reality, you don't have any problem, but disease is growing. Now, so the first 3 stages, the number 1 stage called the stage of accumulation. The toxins are keep on collecting, drop by drop, keep on collecting. In the second stage, they become too much. And in the third stage, now they start flowing here and there because the utensil, the site is full. For example, suppose there is a heat is increasing in the heart. Initially, very little heat is increasing. You can't see any sign. You can't see in the report. Then heat is increasing too much in the heart. Still, you can't see in the report. Now it becomes too much. Now this heat is affecting everything. It is affecting your mood. It's affecting your something, means now slowly and slowly any disease is growing. So in the Ayurveda, these first 3 stages has been explained. First is collection, but in the very small amount, very little amount or the small amount. Second is too much collection, like it might create some aggravation. Too much collection, too much. In the third stage, now it becomes too high. So now it's spreading here and there. So first 3 stages is called avyakt. Avyakt means no manifestation of the diseases. So in the third stage, toxins are flowing here and there. So we can also understand this with a simple example here. Suppose this is the utensil. This is the utensil. In the first stage, there is a little bit collection. In the second stage, too much collection. Too much collection. In the third stage, now collection become too high and it is spreading around. Now, because whatever happening inside the human body. Suppose this is happening in the liver. So now the thing is spreading here and there around. It might go somewhere. It might go anywhere. The toxin might reach anywhere. So toxin will be reaching anywhere. It might reach to the small intestine, large intestine, stomach, spleen, anywhere. Okay. So suppose this toxin is going to the small intestine, but a small intestine is very strong, then toxin will not able to affect the small intestine. Then it's going to the large intestine. Even the large intestine is very strong. Then this toxin will not be able to affect the large intestine. And they will come back to the on-site. Now suppose their spleen is weak or the pancreas is already weak. So this toxin will affect the pancreas or spleen because it's already weak. So now they will suffer. So that is the fourth stage. The meaning of fourth stage, when the toxins are depositing at some site. Why they are depositing? Because that part is weak. If the part is stronger, then toxin will be coming back. It will not able to do anything. This is called stage number 4. Now we can see some changes in the pancreas because toxin has taken the residence in the pancreas or spleen. Now disease will manifest. So now we can see the changes in the report. So now chemical changes happen. So now we can see the chemical change in the reports from the 4th stage onwards, not before that. So when you are getting ill, you are going to the doctor are doing the investigation. If your investigation coming in the report, you already have crossed many levels. So that is called stage number 4. This is very clearly given in the Ayurveda, and the same thing has been explained by the Dr. Voll. So we will be also discussing what term has been given by Dr. Voll. So that is the 4th stage, that is called localization. The meaning of localization means now toxins has taken residence to some local organ, like they have become the local for that organ. Now the disease will be coming in the report. Now the 5th stage, that is manifestation. Now the beautiful name of the disease will be coming like diabetes. Okay. Here they have deposited. Now diabetes appear. That is called manifestation. Avivyakti, manifestation. Beautiful name. Still, you are not treating. Then disease reaching on the critical stage, on the last stage, on the malignant stage, or in the cancer stage. So that is the final phase. That is the phase of complications. Now the diabetic person suffering with the numbness in the feet, no sensation under the feet, problem of the eyes, like the retinitis pigmentosa, vision loss, erectile dysfunction. So many other problems coming in the sequelae. That is the final phase. So the last three phase, we can see the changes in the chemical reports. In the first three phase, there is no any chemical changes. As per the Dr. Bohl has told there are two phases. Number one, humoral. We cannot see any changes in the medical report. That is a self-poisoning process. Self-poisoning is happening, but if you see the medical report, lab report, you will not find anything. No changes in the chemical composition, no change in the chemical report. Something happening just in the liquid, something happening in the semi-liquid. That's it. That is called humoral phase. Then after the humoral phase is over, now disease is taking the site somewhere, and there is a manifestation of the disease that is called cellular phase. Now disease has taken site in the cells, and there is a manifestation. Now we can see the changes in the clinical reports. Now we can see the changes. Now you're checking the diabetes, checking the serum creatinine, checking the uric acid. Then you're finding, oh, something wrong. You already have crossed this stage. Now you're already here. So lab reports can't find any disease in the humoral phase. The lab report means when you are finding the disease, you already have reached on the cellular phase, when disease already grown and now visible in the clinical reports, visible in the report. But luckily, with the help of electroacupuncture of the Dr. Voll, we can find the disease in this phase or in this phase, any phase. We will be learning that. Even very initial phase, we will find the disease and we can treat it. There is no need to wait for the manifestation. So the first phase is called humoral phase. When disease is growing, there is self-poisoning is happening, but there is no change in the chemical report. The second phase is called cellular phase. Now disease has grown, reports has been changed. Now you can see uric acid, serum creatinine, diabetes, and various diseases. Now patient is agree that he is having some problem. Patient will not be agree in this stage. Patient is becoming overweight. We are telling, okay, please take care. Nowadays, every 1 out of 3 getting diabetes. So please take care of yourself, patient, but patient not taking care. Because in the first humoral phase, when there is a changes in the liquid, semi-liquid phases, patient is lazy, not careful. Patient will suddenly careful when the disease is grown, cellular phase. Now will be coming, doctor, I am diabetic. Can you treat my diabetes? Doctor, I got paralysis. Can you treat my paralysis? Doctor, I got high blood pressure. Can you treat my high blood pressure? Can you treat my high blood pressure in 15 days? Can you treat my paralysis in 7 days? Then patient is expecting that he has crossed many phases, but doctor should do something within few days. and doctor are telling, no, we can't do anything. Now you have to take the medicine throughout the life. There is no any option. Thyroid, take the medicine throughout the life because you are already in the cellular phase. Diabetes, take the medicine throughout the life. You already on the last phase. BP, throughout the life. Skin disease, psoriasis, eczema, that is cellular phase. Now take the medicine throughout the life. So now, every phase has been divided in three parts. Humoral phase has been divided in three parts, 1, 2, and 3. Even the cellular phase has been divided in three parts, 1, 2, and 3. It's same like what we have discussed as per the Ayurveda. In the first phase, that is called excretion. The meaning of excretion, there is a body is excreting the toxins and there is a collection is going on. In the first phase, the collection is going on. Suppose one person is doing some cardio, some exercises and doing the sweating. Okay, wonderful. Body will become light. There will be good lymphatic circulation. But person is lazy, not doing anything. No movement of the body. Just eating and sleeping and working. So what will happen? There will be starting of collection of the toxins. Now one more thing. Suppose some person is eating too much curd and the rice during the night. We are telling, okay, don't eat it. But patient is telling, oh no, I'm eating since 10 years. I don't have any problem. But that time you were active. Now you are not that much active. So what's happening? Collection is going on. During the collection time, patient is happy, just feeling little laziness, little tiredness, little lethargy. But he's not worrying for that. And also, see, if check the report, absolutely clear because this is the first phase. But keep on eating the curd and rice. Now they become full. The utensil become full. Now the reaction phase starts. In the reaction phase, might feel little bit reactions, little bit something. Like what reaction? Eating the curd might feel some certainly little throat pain, which automatically disappear. Or some heaviness in the body or some sleepiness. That is reaction phase. The meaning of reaction phase, toxin become too much. Still, this is the time to get alert. But still patient is not agree because disease is not in the report. Keep on eating the same thing, keep on following the same and wrong lifestyle, then reaching to the third phase, which is called deposition phase. Now the toxin has become too much, is spreading here and there. Here and there. That three phases coming in the humoral phase. In these three phases, you will not find any chemical disturbances. There is no disturbances in the blood report. Like one patient came, I told after checking the pulse, oh, be aware, there are chances of diabetes. And I asked her, okay, are you diabetic? Patient felt very bad. How you are telling I'm diabetic? I'm not diabetic. Just I checked my report few days back. Then I thought myself, oh, because in the clinic we should use some diplomatic language. We can't tell someone you're diabetic. Then patient came after 6 months, doctor, I'm diabetic. Diabetes will not appear in overnight. Diabetes will not happen. Like, okay, so diabetes, one day diabetes will come and knock your door. Can I come in your body? Diabetes will not happen in that way. It will be coming step by step. First it is coming to the excretion phase, then reaction phase, then deposition phase. Till the three phase, you are not having any problem. You are very happy by seeing a report, but now it will go in the cellular phase. Your pancreas is already weak. Why? Because you are having family history of the diabetes. So the toxin will get deposited in your pancreas. That is called impregnation phase. Means now no one can separate the toxin from the pancreas. No one. They fully overlapped. They're highly overlapped. Like you see the white color shirt. Take the white color shirt and put in the dye, a red color dye, a pakki dye. Now anyone will be able to separate it? No. In the same way, the toxins are entering in the pancreas. Because you are already having family history of the diabetes, your pancreas is already weak. And you have followed the wrong lifestyle. And you have given chances. The toxin should attack your pancreas. Now it will enter in the pancreas and they will occupy, they will fully merged with that pancreas home. That is called fourth phase, cellular phase. That is called impregnation. With the help of EAV, Electro Acupuncture of the Dr. Voll, we can find the disease at every phase. Still, we can do something in this impregnation phase. Now, degeneration. Now there will be manifestation of the disease. And now it will create many problems. What is the meaning of problem? The meaning of problem, because every one of us is going to die. Every one of us. Right? Like every one of us is going to die, but someone now the process of dying becomes faster. That is called degeneration. Everyone is getting degeneration. The meaning of degeneration, that we are moving to the old age, that is degeneration. But as soon as we got the disease, the process of degeneration becomes faster. So this is happening. So this is called degeneration phase. Now disease is fully manifested. Now you are beautifully smiling and telling, oh, I am diabetic. Now you are going to the diabetes club and there are 100 diabetic people. They are doing cheers. Oh, we all are diabetic. That is degeneration phase, because you know, now we can't reverse it. But as per the Dr. Voll, still we have some hope. We can do something. Now, still you are not doing the right thing, because no one is there to tell you what is right, what is wrong. You still eating lots of unwanted food, still not doing exercise, still not doing stimulation of the pancreas, and still not doing acupuncture or some natural therapy. Now you are reaching to the critical phase. That is the last and the critical phase. Now no one can do anything. Cancer, malignant disease phase. One patient suffered with the cancer. I gave 3-day treatment and he became angry. Doctor, 3 days passed, I'm not feeling any improvement. 3 days passed. He was having cancer since many years. It was growing. He has done chemotherapy, radiotherapy, but still he was expecting that we should do something in 3 days. Okay, doctor, I'm feeling little less in my pain. So the thing is this, when the disease is reaching in the last phase, then there is a limit. Even the treatment will be working in the limit. Okay. So these are the phases given by Dr. Voll. So humoral phase means self-poisoning procedure. The first is small collection, second full collection, and there might be some reactions in the body like the urticaria and all. Now deposition, now the toxin is spreading here and there. Then we are reaching to the cellular phase. The toxin will come and merge with some area. Like if the person is having big pancreas, then toxin will merge in the pancreas. That is called impregnation phase. Now there will be manifestation of the disease and the process of degeneration will become faster. And the final, the critical condition will be appearing. So in this way, this is explanation given by Dr. Voll. Okay. Now Dr. Voll told a very beautiful concept of the foci. The foci means, what is foci? F-O-C-I. Foci means you are going to the doctor. Doctor, my tooth is paining. You are going to the dentist. But disease is not in the tooth. Tooth is a foci. Foci means focus of disturbances. Disease may be in the intestine, but the focus of disturbance is teeth. In the same way, person is getting the pain in the tonsils. Then you are going to the ENT doctor. Then they are telling, okay, you might have to remove the tonsil. But the tonsils are foci. The meaning of foci, the real problem is not in the tonsils. The real problem might be in the liver, might be in the gallbladder, might be in the kidney, might be in the small and large intestine, stomach. So this is the foci. We are having a very good chart that if the problem is in the large intestine, which one will be foci? If you know this tooth is paining, means your large intestine is having some problem. Or your tonsil is paining. We have the different name of the tonsils, means this part is having problem. So it has been told below the puberty, like below the 15, 16 years of age. If we talk about the kids are suffering with tonsils problem. So in the kids, foci mainly is tonsils. But after the puberty, the foci become tooth. So we have seen when we were a kid, it was very frequent to get the tonsil infections. But when we are growing up, then the tonsil infection becomes lesser and the people are suffering with the tooth pain. So before the puberty, before the 15, 16 years of age, the foci is tonsils, and after the 15, 16 years of age, foci become tooth. It means the pain will be in the tonsils, but don't think just the tonsils. If you want to treat the disease, focus on the root problem. So I have given two examples. There might be many foci, too many foci. So what is the meaning of foci? The problem is somewhere in the intestine, but pain is happening in the tooth. So this is called foci. The meaning of foci means acute focus of disturbances. Like we have seen the tonsils in the childhood, and tooth when we become adult. They are the main foci. So I would like to give you one example of diabetes, because in the previous class I told that we will be discussing diabetes, and we should know. As per the Dr. Bowl, if we want to treat the diabetes mellitus, so we have to work on the pancreas meridian, which is on the right side, right? So as per the Dr. Bowl, there are only 4 points that is called pancreas 3, or we can consider as a spleen 3. Triple warmer 1C, AD1, and this is the CI8C or the pericardium 8C. So right now I have to tell you this, but we will be having discussion of each and everything in the detail. So first, if we see the pancreas 3. Pancreas 3 or the spleen 3 that we already know. The pancreas 3 is the main point for carbohydrate metabolism. Not only for carbohydrate metabolism, even it's a very good point for protein metabolism and the fat metabolism. So if there is a disturbance in the protein or the uric acid, we will be using pancreas 3. If there is a disturbance in the fat or fat metabolism, we also using pancreas 3. So pancreas 3 will be the main point of carbohydrate metabolism. And we are going to use this point in the right feet. We will be using local point. We will be using the point in the feet because ultimately we are giving electrostimulation. So the first point will be pancreas 3. I would like to show you the image. So if we are using the same point in the left feet, then it becomes spleen. Then it will be working for blood, for RBC, for anemia, for WBC. WBC means the fighter of blood or immunity, or platelet. Suppose there is a platelet count is more or less, then we will be working for spleen meridian because spleen meridian is connected with the blood and spleen meridian will be on the left side. But right now we want to work on the pancreas. So I am telling you right side. So let's see. So first, because showing the stimulation technique is very easy. So first I would like to show you the points location. If you see my leg, so we can see this is the great toe and the great toe ending. Where the great toe ending, that is the point called pancreas 2. So the meaning of pancreas 2, the junction of great toe and this bone. This is the pancreas 2. But right now our focus is not the pancreas 2. Our focus is pancreas 3. So remember one thing, the pancreas meridian passing from this yin-yang junction, the junction of pink and black skin. Then we can feel this bone. So below the bone, before the bone, there is a pancreas 2. And after the bone, there is a pancreas 3. So this is the location of pancreas 3, right? And the most important thing is this, that we don't have to stimulate the point with the needle. But suppose if you want to stimulate the point with the needle, you are having freedom. I will show you all the technique. Even I am showing you needling. But Dr. Bowl are stimulating with the electroacupuncture. So I can feel the bone here. Then after the bone, if I put the needle here, this is the location of pancreas 3. I'm showing you so that you can understand the exact location. So this is the pancreas 3, right? Just next to the bone. The another technique to find out this point where the toes is ending, from there if I keep my two finger or 1.5 chun, then we are reaching on the pancreas 3. The pancreas 3, one of the great point for carbohydrate metabolism means diabetes, for protein metabolism, for uric acid, gout, and fat metabolism. If someone want to work for cholesterol and want to reduce the body weight. In these all conditions, we are using this point that is called pancreas 3. This point is very important. If we see as per the TCM, this point is very important because pancreas 1, pancreas 2, pancreas 3. This is the third number point. And the third number point is called stream point. In any meridian, if we stimulate the third number point, it can balance a complete meridian. Like if we talk about the liver, so liver 1, 2, 3. Liver 3 can balance a complete liver meridian. In the pancreas, pancreas 1, 2, 3. Pancreas 3 can balance the whole pancreas meridian. In the spleen, spleen 1, 2, 3. Spleen 3 can balance whole the spleen meridian. In the stomach, that is stomach 45, 44, 43. Stomach 43 can balance whole stomach meridian. So the third number point having that capability. So the first point for the diabetes, that is pancreas 3. Now the second point. The second point will be, that is called triple warmer 1C. That is the triple warmer 1C. So this is the joint. So we know the ring finger is the finger of triple warmer meridian. And on the tip, we are having triple warmer 1, and where finger is ending, that is the location of triple warmer 2. So there is the middle junction, middle phalanx joint, or the neutral joint, or the pitta joint. From there, if we go down, that is the location of triple warmer 1C. That is a measurement point, and it is a very wonderful point for endocrine functioning of the pancreas. What is the meaning of endocrine function? The meaning of endocrine functioning, the pancreas is having two parts. One part secreting enzyme. But right now, our focus is not the enzyme. Our focus is insulin hormone. The second part is secreting hormone. So the part who is secreting hormone, that is called endocrine. Okay, endocrine. The part who is secreting enzyme, that is called exocrine. So our focus is not the exocrine, our focus is endocrine. So triple warmer 1C is the point who will be improving the endocrine functioning of the pancreas, means insulin hormone. Remember, pancreas is the very big gland. It is called mixed gland. The meaning of mixed gland, who secrete enzyme and hormone both. Enzyme means good for digestion of the protein, carbohydrate, and fat. And the meaning of hormones, like the insulin. So our focus is insulin. So if we can stimulate the triple warmer 3 in both the hands, definitely we can just do in the right hand, but triple warmer 1C measurement point can be stimulated in both the finger. So look at this ring finger. So as per the Dr. Voll, the triple warmer meridian is passing from the junction Then we are reaching on the middle joint. So just next to the middle joint, if we are going down, we can feel the depression, we can feel the border bone. That is the location of triple warmer 1C. I am putting the sujung. Dr. Voll doing just stimulation with the help of electrostimulation, but our choice. Or we can put the seats, magnets. So I'm putting the seat in the other hand. This is the location, this is the joint, and just below the joints, we can feel the depression. That is the location of triple warmer 1C. The triple warmer 1C point found in both the hands, and the main function, improving endocrine functioning of the pancreas. The diabetic person means there is a disturbance in the endocrine functioning. The point number 3. Because when the person is suffering with the diabetes, we have to think about the allergy of this lower part. There might be allergy. There is allergy in this lower part where we are having pancreas. So we will be taking one point in the allergy meridian. And we will be taking one point which is called the allergy point of lower part. Now, this is not only for the pancreas. Any problem in the lower part which is connected with the allergy, you are feeling itching, or any problem which is connected with the allergy in the lower part, you can treat this third number point, which is called the point in the allergy degeneration meridian, which is called the allergy point of the lower body. Let's see the third number point. In the future, we are using this point for multiple purpose. AD1. So AD1 point we can see found in the tip of the middle finger. That is the AD1, allergy degeneration meridian. Measurement point. This is the very good point for allergy of lower part of the human body. Now in the future, I will be using this point whenever there is an allergy in the lower part. Any allergy in the lower part, AD1 will be useful. So let's see in my hand. Remember, all the points are more effective in the right side. I'm showing you left side because other than pancreas, we can put all the points bilateral. So you can see my middle finger. If we go on the radial side or the index finger side, that is the circulation meridian or the pericardium meridian. So we are going to the other side, that is the allergy meridian. So this is the allergy meridian, small finger side, or it is called ulnar side. So allergy meridian starting from the corner of nail. So this is the starting of the allergy meridian on the corner of nail. So we can see this is the starting of allergy meridian from the corner of nail. Then the allergy meridian passing from the border of the bone. And this is the first point that is called AD1 or the allergy degeneration 1. And this is the measurement point if there is allergy in the lower part. So we can use this point bilateral. We are using this point bilateral. We can put the star magnet. We can do the electrostimulation. We will be looking everything. Allergy degeneration meridian, third point. So the first point was in the feet, pancreas 3, only in the right feet. The second point is triple warmer 1C, which is improving the endocrine functioning of the pancreas bilateral. Third point, AD1, allergy point for lower part. Now let's see the final point. And just by using the 4 point, we will able to treat the diabetes successfully. Now this point is found in the pericardium meridian, which is called AIP point. What is pericardium? The meaning of pericardium is brain. The meaning of pericardium, the nerves coming from the brain. So now we are using pericardium 8C point or CI 8C. CI means circulation meridian or the pericardium. And this is the AIP point. The meaning of AIP point. Who is improving relationship of the brain with the spine and the organ. So brain is giving message to the spine and spine is giving message to the area of pancreas. So this pericardium 8C is the point of aortic plexus, abdominal aortic plexus. So look at here. So this is the heart. This is the heart. Heart is pumping the blood. Heart is pumping the blood with the help of aorta. Aorta. Then aorta means bigger pipeline, bigger artery. After that, aorta, the small branch called arteries, but here it is called aorta, a bigger one. Heart is pumping the blood. This aorta is coming in the abdomen. Then it's called abdominal. It's called abdominal aorta. Abdominal aorta. So the nerve around this, making one transformer, making one plexus, making one spider network like structures and passing electric signal here and there. And this is the nerve plexus. The point of this is pericardium 8C. So this is very near to this whole aorta. Aorta means abdominal aorta means supplying the blood in this whole abdominal part. That is called abdominal aorta. So pancreas, if there is a blood poor supply from the heart, now improve the electricity with the help of abdominal aorta. So point is pericardium 8C. Whenever you are treating any problem here, like suppose you want to treat any other problem of the abdomen and you want to improve the plexus, you want to improve the circulation, then you can use this point. CI8C, we can see in this image, in the middle finger, below the middle joint, this point is located. Bilateral. AIP point for abdominal aortic plexus. The meaning of plexus means the network of nerve. So if you look at my middle finger, in the middle finger, this side it was allergy meridian. But on the radial side, thumb side, this is the circulation meridian. And this is the middle joint. Just below the middle joint, this is the location of pericardium 8C or the CI8C. So let's see, we again will stimulating with the help of needle. So you can see here. So this is the middle joint. Below the middle joint, we can feel the depression here. And we are putting the needle here. There is no tonification sedation, just the needle. Or we are doing electrostimulation, or we are putting the star magnet or the methi seeds. So this meridian found in both hands. So that is the final point. So look at the middle finger, middle joint. And before that, this is the point, sorry, on the other side. CI CI8C, AIP point for abdominal aortic plexus. So this is the seat. And this is the needle. Visible or not? Visible? Hand is visible or not? Now look at in the chart. So this is the location of CI8C. In the middle finger, so let's see all the 4 points once again. The first point was pericardium 3. On the right leg. The second point was triple warmer 1C. On the ring finger below the middle joint. That is improving endocrine functioning of the pancreas. The third point was on the tip of the middle finger, allergy degeneration 1, which is a very good point for allergy in the lower part. And the fourth point was for improving the pericardium meridian nerve plexus, CI8C. With the help of these 4 points, we can treat the diabetes. Okay. Done. Fine. No, see my arrow. Wait, where up? What you're telling? Sarabjit ji, are you telling something? I'm not able to understand what you're asking. If you want to tell, you can unmute. Anything? Yes, please. Yeah, unmute.
तो वहां पे 2 पॉइंटर बताए हैं ना, तो कौन से वाले उसमें कंफ्यूज हो रहा है?
मैंने एरो दिखाया ना।
हाँ,
एरो वाले को, नीचे वाला। मैंने जो उंगली नीचे बिलो।
ओके 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 ओके, क्योंकि 2 पॉइंटर दिख रहे हैं ना, तो इसीलिए
हाँ, बिलो बिलो।
ओके,
so only 2 minute break, 2 minute break, then हिंदी। 2 मिनट के बाद हिंदी में।